Hello there. We are very happy and very much excited because today we're receiving within our studios a very special guest, very special because of his ministry, through which the Lord has been using him in incredible ways over the years and is still using him through it. Talking about the ministry of chaplaincy, and this is what we're going to discuss about. He's very busy, but he's been willing to share some of his experiences with us. I'm very pleased to present to you Pastor Dr. Mario Ceballos.
Thank you very much. It's a pleasure for me to be here.
Thank you, Pastor. Thanks for accepting our invitation. God bless you.
Thank you.
Well, Doctor, could you please tell us about the chaplaincy ministry?
Chaplaincy ministry is a specialized ministry.
Right.
We always say that all chaplains are pastors. Not all pastors are chaplains. A chaplain to ministry is like a surgeon is to medicine. All physicians are not surgeons, but all surgeons are physicians. A chaplain is a pastor that specializes in the area of ministry in an institution rather than in a church.
Right.
So a pastor is a pastor for a church. A chaplain is a pastor for a hospital, for a university, for a college, for a military unit, for a prison, you name it, all kinds of ministry. The importance of a chaplain to be a pastor is because a chaplain is expected to perform the functions of a pastor. Those are besides pastoral counseling and pastoral care, marriage counseling, perform weddings, baptisms, communions. Those are parts of the role of the chaplain.
Thank you, Doctor. By the way, how long have you been into this ministry?
I have been into the ministry as a pastor for more than 30 years. At the same time, I have been also as a chaplain for a little less than that, for about 28, 29 years.
You've been around for a while, so
yes,
you're a veteran, I would say.
Well, we have spent some time there.
All right. Now, Doctor, can anyone become a chaplain?
Well, anybody that wants to become a chaplain, the same thing like for anybody that wants to become a surgeon, you go to medical school, become a physician, specializes in surgery. The same thing. For anyone to become a chaplain, just have to do is become a pastor, go to theology school, get your degree, spend some time in the field being a pastor, and then specialize in that area. Especially in the area of healthcare chaplaincy, we have a specific residency for that, for pastors that want to do that, and it's called Clinical Pastoral Education, or CPE. And that is about a year that you spend in a hospital, getting training with the physicians, with the nurses, and with everybody else to help you become integrated with the medical team.
All right. Now, do chaplains work like normal workers, like civil servants, or do they work like doctors that sometimes, though off duty, can be called for some emergencies?
Yes, it is the same. And both, as you mentioned.
Right.
Some chaplains are like civil servants because they are employed by the government to work in prison, for example, to work in the military.
Right.
Also, as physicians, they are assigned or they are working in a hospital. They may be employed by that hospital. When they are employed by the hospital, emergencies, middle of the night, we all have to be on call, and we have to sometimes, if we're on call in the middle of the night, there is an emergency, and the chaplain is called, and you come in. So it's like both, depending on what area. Even if you are in a school as a chaplain, there may be an emergency. A young man is having a crisis, or a woman, and sometimes chaplains are called when, sadly, a young man decides to take his life. And then the chaplain comes in, not only to help with the person who's already dead, but with the students, their fellow students, with their family, with the teachers. There is a lot of work involved because there is a lot of suffering, there is a lot of turmoil in the lives of everyone when something like that happens, or they are killed in an accident also. Chaplains always come in and they work with everybody.
All right. By the way, have you ever faced the case of someone that wants to take his life out?
Oh, more than once. They have come to me, and they have used, as we say in some areas of chaplaincy, the S word.
The S
meaning
word.
S word meaning suicide.
Yeah.
When they use the S word, then it is very, very challenging for us chaplains, because when someone comes and confesses or tells you that they want to take their life, they are telling you that in confidence. There is the parishioner clergy confidentiality clause that come into it. Now you are bound by your votes as a chaplain and minister. You cannot be telling people about that person wants to kill themselves. So our role or job there is not to leave their side until they are willing to seek help. So we make sure we take them by the hand to see, for example, a professional like a psychologist, and then we turn them over to them. Not to tell the psychologist what the person told us, but to make sure that the person tell the psychology what is it that he or she is going through, so that they can receive the help that they need.
All right. But is there a psychological aspect to your ministry?
Yes, there is, but we need to understand that there are roles that each one of us play, and what are the differences and what are the boundaries.
Definitely.
I'm trained as a pastor, not as a psychologist. And even if I was trained as a psychologist, but I'm working in the role of the chaplain, we make sure that we don't cross that barrier, even if I know. So I make sure that I take the person to a psychologist that is in that role, so that the person can be helped in that area. Sometimes that may be stressors that are created that are leading that person or are causing that person to come to that position. Sometimes it can be a chemical imbalance in their brain. And that is to a psychiatrist also to investigate and see how that person can be helped.
All right. Now, doctor, we know that pastors sometimes have most of the time actually have some targeted number of people that they want to get baptized, so number of church members would increase. Do chaplains have similarities with them?
Well, remember that I'm a pastor.
True.
And I worked as a pastor before. The problem sometimes we have when we have a number to be baptized is that we only baptize that number.
True.
And no more. So for us as chaplains, as we work with people, our goal is to share, first of all, as Ellen White says in her book, Ministry of Healing, that the method of Jesus was to mingle with people as one that desires their good. Then he met their needs. That's what the chaplains are. We meet their needs. And as we meet their needs, we share the gospel with them. And our goal is to baptize everyone that we come in contact with. That should be the goal. So we share the gospel, and then we let the Holy Spirit decide how many of them wants to hear the voice of Jesus when he bade them to follow him.
So leaning on the power of the Holy Spirit. I can remember one verse in the Bible saying that 2,000 were baptized in one day. Through the power of the Holy Spirit. Well, have you been in the course of your ministry being involved in hospitals?
Most of my chaplaincy ministry has been in hospitals. I have worked full-time in different Adventist hospitals in the United States, as well as in my ministry in the military. Many times part of that ministry was in the hospital. I'm a board certified chaplain according to or by the Association of Professional Chaplains, and my training in hospital clinical pastoral education, that is one of the areas that I specialize more.
All right. Now, I want us to focus more on this hospital side of your ministry. What do you do when you get into a hospital? Inside the hospital, what do you do first? Where do you go?
Chaplains are part of the healing team, part of the medical team. So you are included in the rounds with the physicians.
Right.
You are part of the rounds with the nurses when they change shift. You are assigned several units. One of the hospitals that I work is Florida Hospital. They have over 1,000 beds. It's a major hospital.
Right.
Hundreds of surgeries every day. In my hospital, I was in the area of the emergency room, as well as in some of the cardiology areas.
Right.
So cardiac care recovery, open heart, we had 10 to 15 at the time surgeries, heart surgeries only a day, transplants, open hearts, etc., etc.
So you are there.
So yes, the major role is you first come in and you have the list of your patients. You have the list of what patients have indicated that spirituality is important to them.
Okay.
So you know that they are open to receive spiritual care. You talk to your nurses. They are the guardians of the doors. They know who they need more help. And then they will tell you, well, chaplain, I want you to visit this or the other patient. When you do rounds with the physicians, some of the physicians says, chaplain, such and such a patient needs your help.
Right.
So then you come into the patient's room, identify yourself, and then you do a spiritual assessment, find out what their needs are, what is their major religious affiliation if they have one. And then one of the major roles of the chaplain in the hospital is to listen to the patient. When we train chaplains, we tell them the words that you need to learn is listen to their stories and listen to their confession. There is a saying that confession is good for the soul. So being able to be there with them, pray with them is essential. We don't have the time, but different studies have shown that the prayer, the presence of the chaplain, spiritual intervention is very helpful in the healing process of our patients.
All right. Just to remind you, we're here in the West Central Africa Division studios, and we are with Dr. Mario Ceballos, and we're talking about his ministry as a chaplain, talking about the ministry of chaplaincy. Now, Doctor, let's say you are in a sick room, right? And you know this person is going to die in 24 hours. How would you minister to that person?
It's very interesting that you asked that question. I have been in situations like that many times. I remember one time I was visiting a patient and she looked at me and she said, we are more merciful with animals than we are with people.
Wow.
And I asked, why do you say that? He says, well, I am going to die, and very soon. And also when we are with a patient that is close to death, we really don't know if it's 24 hours or 48.
True.
So it's very hard to determine that. But then I asked her, tell me more. And she said, because that's the role of the chaplain. Before you do anything, you want to hear more where they are at, what their spiritual condition is. And she said, I know I'm going to die, I'm dying. The doctors already told me that. But they continue to do tests on me because they want to know how soon, if it's 24 hours or 48 hours or a week. It's not going to be more than that. And it's very painful. I wish they would just let me die.
Wow.
When a horse breaks a leg, they put him to death. And with us, they just do experiments and tests on us. I'm not advocating for euthanasia, for killing people. But sometimes when people are at that time, what I recommend to the family and to everyone is you need to just relax, enjoy these last minutes. I always call the work of the chaplain when you go into a room when someone is dying, actively dying, is holy ground. Is the time when you want to get a very close connection with God. Many patients, when they are at that time, they call for chaplains to come, to pray, to help them get in touch with God, to ask God to forgive all of their sins. God is going to call them to rest. I remember one time another lady came up to me. I was called at 3 o'clock in the morning.
3 o'clock.
And I came in, and as I was coming in, she was coming out of the room where her father was dying. She looked at me and she said, Chaplain, if I don't do anything, if we disconnect my father from the different monitors and medicine, is that like killing them? So there are existential questions that patients have during those moments of death. And being able to process those questions with them and helping them understand the process of life and death, that death and dying is part of living.
Yeah.
It is something that is sacred, and it is important for chaplains.
All right. Wow, so much to say about this.
Oh, yes.
Well, have you ever seen a difference between, when it comes to facing death, between someone that believes in God and someone that does not believe in God?
Yes, and I can tell you about that in a person that didn't believe in God and believe in God at the same time as in the process of dying. A man was dying and he suffered a stroke.
Okay.
He was someone that didn't believe in anything.
Right.
A very rude person. I never met him in life, but the family tells the story that he was not a very pleasant person. Yeah. And he suffered a stroke, and there he was, struggling between life and death, struggling and struggling and struggling for about a couple of days. They didn't know what to do. The family was concerned because even though they didn't want him to die, they wanted him to rest, and he was very restless during those day or 2 days. Right. The chaplain was called. One of our chaplains on call, it wasn't me. Yeah. She was called to come in. She did not know that he was a person that did not believe in anything. And out of ignorance in a way, she came in and spoke with the family, and then she offered to pray for that man, not knowing. And she prayed for him, a man that did not believe in God, we think, and restless. Yeah. And then within 5 minutes, after she finished praying, his countenance changed. He was at peace. Wow. And within 5 minutes he died. So it is very interesting. There is a saying that says that in the foxhole where the soldiers are, there is a lot of belief in God. There are no atheists in the foxholes. Yeah. Because once you are at that point in your life, the existential questions and your connections with God, whether you never believed before, sometimes are very helpful in that process.
All right. The Lord created us into His image anyway, so there should be some part of the Lord within us somewhere. All right. Well, what has been your greatest challenge in your ministry?
Oh, there have been many challenges in my ministry. It's hard for me to point to just one of those challenges.
Share some.
But I rather talked about what has been the greatest joy in my ministry. That also are challenges.
We'll come to that. But
in the challenges, I think lately has been my distance from day-to-day contact with the patients. I was called to lead chaplaincy at the General Conference at the World Church, and that keeps me very busy.
True.
And in that position, also another great challenge that I have is that around the world, people really don't understand what is the role of the chaplain. They do not understand what is a chaplain. And we have many people that are called chaplains because of their role, and they don't know their job. I have been in places where they have come to me and said, Pastor, they asked me to be this chaplain of this college, and I don't know what to do. Nobody has taught me. So the greatest challenge that I see is education of chaplains, education of ministers to become chaplain, and educations of the leadership of the church, institutions, so that they understand what is the role of their chaplain. So that's one of the things that we are most involved. We have developed an Institute of Chaplaincy, and I'm just coming from Nairobi at the Adventist University of Africa, where I taught a class. No, Adventist University of Africa in Nairobi, where I taught a class in the Masters of Chaplaincy. When I finish here, in about 3 weeks, I'll be in Loma Linda, where they also have a Master's in Chaplaincy, and I'm teaching a class there. I also coordinate the Doctor of Ministry degree with the emphasis in chaplaincy from Andrews University. So as you ask, the greatest challenge is the education of chaplaincy, not only of chaplains, but also of leaders and the church and the public to understand who is a chaplain and what is the role of the chaplain and what it takes to be a chaplain. One of your first questions.
Yeah. Well, what has then been your most amazing experience in your ministry?
Well, in my chaplaincy experience, I have had, again, so many of those. It's hard to pick.
I can imagine
I remember going into a room where a person was being prepared for what is called a heart catheterization. They go in the vein, in the leg, and they go all the way inside the heart. They inject a dye, and then they take a picture. In other words, it's like an X-ray. And then you can see if there is any problems or where blockages are in the arteries or veins in the heart that are feeding the heart, to determine whether the person needs a procedure to open that artery or a bypass. And I went in, the person had a very high blood pressure. I was young in my ministry, came in, talked to the person for a while, and we pray. As I left, being like Thomas, doubting what I have done, I left and I said very slow, very low, well, I don't know if I was of any help. And as I was walking out, he didn't hear me, but the nurse did. And the nurse says, "Chaplain, you stop and turn around." And when I turned around and I looked at the monitor, the blood pressure has dropped considerable. So seeing that is one of my pleasures. And also, as I finished my class in Nairobi a week ago or so, seeing the responses of the pastors there that are in the Masters of Chaplaincy, saying, "Wow, now I understand what chaplaincy is all about. I didn't have a clue that chaplaincy is what you are telling me." So seeing that change has been very helpful and has been one of the joys of my ministry.
Wow, it's good to hear that, Pastor. Lots of testimonies to share. We're really having a very short time, and we would have to, go a little bit faster. Now, someone say that it is through the power of the divine, combined with human efforts, that the mission work is done effectively. Would you agree with that statement?
100%, because when we look at the healing process of patients, it's a combination of the two. I remember I was adjunct professor at Florida Hospital, also with the residency program, and my study was with patients in the hospital that were going for or coming to see the doctor, and they had problems with high blood pressure. And one doctor was having trouble with one of his patients because she was not taking the medication. And she was saying, "No, I don't have to take my medication. God is going to take care of me." Whoa. And then the doctor began talking to her, and she said, "Do you think that God helped me to go through medical school?" Yes, of course, yes. And then he said, "Do you think that God helps me and works through me when I treat you and I give you the medications?" And she said, "Of course, without God, you're nothing." I said, "Well, if you don't listen to what I'm telling you, it's like you are disobeying God."
True.
So the combination of both, people, what my research show that sometimes people that see that there is a dichotomy between medicine and spirituality, and the work of the chaplain is to help them understand that there is none, that they both work together. That is essential, and we can see that in the life of Jesus.
All right, we are tools in the hands of the Lord. The Lord has created us to serve Him and to witness to the world, to spread the gospel of His love. And one pastor said one day that we are the extensions of the hands of Christ. It was a couple of days ago, actually. And I can see that through your ministry. Well, Pastor, Doctor as well, could you tell a last message to our viewers?
Yes. I like to encourage everyone that feels that call of chaplaincy in their heart to join us. There are trainings that we are organizing all over Africa. We have a master's at the Adventist University of Africa. Clinical training will be coming very soon also. And join us. The work of the chaplain is a magnificent job. It's the job of Jesus Christ. So I encourage you to seek the lost, to look for those that are in pain and suffering, and minister to them just like Jesus did, filling their needs and healing them by the power of Jesus.
Thank you so much, Dr. Mario. Well, we will end with these lines. It is through the power of the divine combined with human efforts that the mission work is done effectively. We will leave you for now, hoping to see you again. Bye-bye.